Watch this video and find out how to book your complimentary LASIK consultation.
Welcome to Healthy Frontiers. My name is Dr. Bizzoni. This show is dedicated to the education of our viewers. The topic for this evening is everything you need to know about LASIK surgery. My special guest is Dr. Saimovici. Dr. Saimovici is a member of Mount Sinai Hospital medical staff and the School of Medical faculty. He was the chief of refractive surgery clinic at St. Vincent's Medical Center until it closed. He's a board-certified ophthalmologist. He is a comprehensive vision correction specialist performing all FDA-approved procedures for the correction of nearsightedness, farsightedness, presbyopia, and astigmatism. He has his MD degree from Medical University of South Carolina. He was chief resident at Georgetown University Medical Center in Washington, D.C. He has a private practice presently in Manhattan since 1984 and also in Westchester since 2002. He was the first doctor to place an excimer laser for the correction of vision problems in a private practice in Manhattan. He's an inventor of a very specialized eye instrument and presently has lasers in Manhattan, Somers, and recently in Larchmont. So I'd like to welcome Dr. Saimovici to the show.
Thank you.
Welcome, Doc. We're going to talk about lasers, something people see. It's getting very popular. Why don't we talk about some common vision problems so we have somewhat of a background so people understand why LASIK may be important for them.
Sure.
So let's talk about nearsightedness, farsightedness. Go ahead.
Nearsightedness, vision problems in general are
Yes.
conditions that can be corrected with glasses or contact lenses, or nowadays with what we call refractive surgery. That's the medical term for permanent correction of vision problems such as, again, nearsightedness, farsightedness, astigmatism, and a condition that does not really have a lay term known as presbyopia. And in order to understand exactly what all these conditions are, I think we should refer to the model of an eye, which functions more or less like an old, quote-unquote, old-fashioned camera, meaning a camera
Sure.
that had film in it.
Yes.
And at the very front of the eye, there is a layer of tissue known as the cornea.
Yes.
The cornea is clear, much like a soft contact lens. And it's a window into the eye, and at the same time, a very powerful lens. Those are looking at the show and know their prescription for glasses or contact lenses, and they see a number like 5 or 3 or 6 units. Those are diopters. Those are the units that we measure nearsightedness, farsightedness, and or astigmatism.
Right.
This lens is very powerful. It's about 40 diopters. So any change in the shape of this lens is going to cause significant changes in the way we see.
Right.
The idea is that we have to have the light rays go through the cornea, through the lens, which is behind the iris, which is like a curtain. Usually when you look at the window of somebody's home, you don't see the glass. You see the curtain behind the glass.
Correct.
So you don't really see the cornea. You see the iris that gives us the color of our eyes, blue, green, brown. And then there's another lens behind. And then the light rays have to focus on the back of the eye, which is lined with a layer of tissue, much like the film in the camera,
Sure.
known as the retina. So if we are nearsighted, the image focuses in front of the retina. And that means that we can see fairly well here at near, but we cannot see far away. Somewhat the opposite is true for farsightedness. Farsighted people, the image is focused in such a way, it's technically speaking, is focused behind the retina. But people who are really truly farsighted don't see well neither at near nor at distance. If they are a little bit farsighted and they're young, they see very well in the distance. But if they are more farsighted and with age, even the distance begins to go. And then what happens is that with age, this lens, which when we are young functions like the lens in an autofocus camera that's always in focus,
Yes.
it ages.
Right.
So around the age of 45, everybody practically, whether even if they never wore glasses before, they start to do that, and then eventually they need reading glasses. And that condition is known as presbyopia. There is no lay term for that. It's a medical term known as presbyopia. Most people call that farsightedness, but that's incorrect.
I see.
So presbyopia is a condition of aging that affects everybody, and it has to do with this lack of ability of this lens to continue to focus both at far and at near. So this laser vision correction and other methods of permanent vision corrections correct for all of these vision problems. There are literally four.
Right.
Nearsightedness, farsightedness. Oh, and I left out astigmatism.
Yes.
Astigmatism means that the cornea, or the lens, but usually it's the cornea, is shaped as if it were part of a football rather than part of a basketball. In other words, it's more round or steeper in one direction than the other.
Yes.
And the laser can correct for astigmatism as well. It's a terrible sounding term, and
Yeah.
people are say, "Oh, I have astigmatism." No, it's nothing.
Yeah.
It's just that the cornea is a little
Off
bit
shape.
like a football rather than a basketball. That's
Very
all
clear.
there is to it.
Okay. Besides those problems, there are other problems which can be corrected by glasses, contacts, and laser. What are some of those other eye conditions, like cataracts?
Well, you can look at the anatomy of the eye. Again, the cornea can be very weak and has all sorts of diseases that affect it. Dry eyes can affect the cornea. Then the most common condition that everybody knows is that a condition of aging as well, known as cataracts. That means this lens becomes cloudy.
Yes.
And as it becomes cloudy, it can be removed with special instruments that are extremely small, like a tenth of an inch. A small incision is made at the edge of the cornea. This lens is removed, sucked out literally.
Yes.
In the past, it has been done with sound waves, known as phacoemulsification or ultrasound.
Yes.
Nowadays, we're developing lasers to be able to do that, to remove the lens. And then this lens is replaced with a lens implant.
I see. Okay.
We now have multifocal lens implants, which means that they take the place of those progressive glasses, which allow people to see both far away and near. And we also have accommodative lens implants, which they do the same thing. So it's like going back to the youth
Sure.
youth restoration.
Right.
Besides the cataract, which I'm sure that in a few years we're going to remove the lens just because it doesn't focus anymore and replace it with a lens that focuses it even before it gets cloudy. There is fluid that's being produced in the eye, and the fluid goes to the front of the eye, and if the drainage apparatus does not function properly, the pressure in the eye rises, and that's known as glaucoma.
Yes.
So glaucoma simply means,
Increased
simplistically put, is increased pressure in the eye. This pressure can damage the optic nerve as it exits the eye to carry the sight from the retina to the brain.
Right.
And people can lose sight from the pressure if it goes untreated.
Right.
There are several types of glaucoma. The most common ones are open angle and narrow angle.
Yes.
The open angle comes very slowly, insidiously, and you only find it if you go to the doctor, or if it's too late and you begin to notice that you lost field of vision.
Yes.
Narrow angle is actually even more difficult because you may not know you have it, and it's very common, or a lot more common in people who are farsighted. Because when you're farsighted, everything is a little bit smaller and squeezed together.
Yes.
So the angle through which the fluid goes out is narrower, and it has a tendency to close off. And if it closes off completely, the pressure shoots up, and you can lose sight within a matter of hours.
And is this something, an aging process also, or is it a disease process? What are some of the causes?
Well, it's part genetic,
Okay.
and it's part, if we're talking about the open angle, it's probably mostly genetic, not that it's transmitted from its family, it's familiar, meaning you're more likely to have it
If your parents or
if your
grandparents
parents have it,
okay.
but it's not necessarily strictly hereditary.
Right.
Narrow angle is also partly genetic, and what happens is as lens ages, it also becomes a little bit bigger, so it pushes the iris forward and causes the angle to become narrower. So both of them have a genetic component to them.
Okay. And the laser will, as we're going to speak about in a few moments, will help to correct that problem.
There are different lasers. Laser is an acronym.
Okay, we're going to talk about that in a second. Let's talk about one more thing before we go on to that.
Okay.
How about macular degeneration, which is a real common problem as well, isn't it?
Okay, I was going to get to that.
Go ahead. Yeah.
It's not quite as common as glaucoma and cataracts. Unfortunately, it's more problematic in that it can cause severe loss of vision.
Right.
Because the macula, it's a tiny little spot. It comes from Latin macula lutea. They call it a yellow spot.
Okay.
And it's really about 1 millimeter, and there are 25 millimeters in an inch. So do the math, and you realize it won't take an inch divided in 25 parts. And
sure.
Actually, they're really center, it's half of that. But that gives us about 80% of our vision, and that's what gives us our central vision, our sharp vision, what we read, what we watch television, what we recognize a person. And there are conditions, again, probably genetic, and they have environmental factors that make it worse, that causes a degeneration of this macula. There are two kinds, again, the dry and the wet.
Yes.
The dry is sort of a slow progression, and most of the time is not that damaging to the vision. The wet, unfortunately, means the blood vessels start to grow into the macula, which they shouldn't be there,
Right.
and they cause leaking and damage, and that is a lot more dangerous to the side.
Yes.
Fortunately, we do have lasers for that, and we now have even from the cancer treatments, we have drugs that when injected into the eye, make those blood vessels go away. So nowadays, fortunately, we have a lot more things we can offer somebody who has macular degeneration than we used to.
Great. So let's get into the meat of the talk right now about laser. Exactly what is laser?
Laser. Well, laser, it's an acronym, first of all, the word.
Yes.
Technically speaking, it should always be capitalized. It's a light amplification through stimulated electron radiation.
Okay, wonderful.
Fancy word,
Yeah,
physics.
easier with laser.
Yeah.
Go ahead.
So laser essentially is like an engine, like you say, a motor. It's a boat motor, it's a car, an airplane. There are all sorts of lasers. They
Yes.
have different color lights. They have different types of energy. Sometimes some lasers are extremely fast. Some lasers are slower. Some lasers are hot. Some lasers are cold. They're just like the engines.
Yes.
They're the
Yes,
whole.
yeah. I mean, you can have hair removed with laser.
Exactly. Right. So there are lasers for the treatment of the macula. There are lasers for the treatment of glaucoma, and there are lasers for the treatment of nearsightedness, farsightedness, astigmatism, and or well, presbyopia is actually treated better with another procedure.
Right.
But so laser, it's a device that creates a certain type of energy that has qualities in this energy in such a way that does whatever we want it to do for that particular
Right.
need that we have.
Okay.
In the vision correction,
Yes.
we use primarily a laser known as an excimer laser. And
Yes.
the word comes from physics, doesn't really mean anything.
Yes.
But this laser, it's also called a cold laser or an ultraviolet type laser. And the energy is such that in extremely short bursts of energy is able to break the molecular bonds, essentially to vaporize tissue with such an accuracy that we can correct the shape of the cornea and make it very smooth like it
Yes.
was in the beginning.
Yes.
This application actually was invented up the road here at IBM.
Oh, really?
IBM had the original patent on this. They were looking at ways to etch transistors on silicon chips.
Yes.
And somebody thought, well, if we can etch silicon, we can maybe etch the cornea. Sure enough, because all the other lasers, the problem is, yeah, they can burn the cornea, but we don't want it to burn. We want
Yes.
it to vaporize, to break the molecular bond in such small amounts, so as to not cause scarring.
Yes. So important. Otherwise, you'll have another problem.
Otherwise, yeah. Right. And so in nearsightedness, what we do, this lens, this cornea, which functions as a lens, is too powerful, and we need to flatten the center. So on the average, all it's required is to vaporize such a small amount that it's very hard to imagine. So only
Yes.
about a quarter to a third, the thickness of a human hair.
Wow.
That's the
That's so
whole
thin.
operation.
Yes. Okay.
That's the whole procedure.
Yes.
On the average. Sometimes
Right.
it's more. I just had a patient today, she's like, about like that. She's going to be about 3/4 of a hair.
Right.
It never goes over.
So thin.
I
Yeah.
promise you, it never goes more than the thickness of a hair.
Yes.
So in nearsightedness, we polish, we shave off, we vaporize, whatever term you want to use, the center of the cornea. In farsightedness, we remove more from the outside of the cornea, so the center of the cornea becomes steeper.
Yes.
And because we actually need to make this lens a little bit more powerful, so the steeper it is, the more powerful a lens.
Right.
And for astigmatism, this is a polishing tool, so we shave off in the area that we need to shave off more, and to make it nice and round in all directions.
Right. Okay. That's
So
the
that's
football.
how the laser, right? So
Football to basketball.
correct the football to make it a basketball.
Got it. Okay.
So just make it round in all directions. So that's how the laser works for the correction of these three conditions. Now, the laser, this shaving of the cornea or change in shape can be accomplished in two ways primarily.
Yes.
On the surface of the cornea,
Yep.
or underneath a flap. And nowadays we have a flap, and the flap itself it's also less than the thickness of a hair, or about as thick as a hair. So because it's so thin, it takes the shape of whatever we do underneath the flap.
Yes.
Nowadays you may have heard the term bladeless LASIK.
Yes.
In the past we used to use the special instrument known as a keratome. They had a blade that oscillated about 10,000 times a minute that created this flap, literally cut.
Yeah.
Now we're cutting the flap with another laser.
Yes.
It's called a femtosecond laser.
Okay.
It's about 10 to minus 12 seconds. It's like very hard to imagine. Anyway, that laser cuts the flap. We open the flap. We use the excimer laser to remove whatever amount of tissue, the third or the quarter of the thickness of a hair, and then we put the flap back. That's LASIK.
Okay.
Or we can do it on the surface of the cornea. The cornea has a layer of tissue known as epithelium. It's like the skin. If you fall and you scrape your knee,
Sure.
it takes a few days and the skin grows back.
Correct.
So if anybody ever had a corneal abrasion, they know what I'm talking about. That
Yes.
means that epithelium
Was brushed. Yeah.
was kind of scraped off. So that epithelium is about a third the thickness of a hair. So if we use the laser directly, we wouldn't achieve anything because 2 days later it will
Come right.
regenerate. So we have to remove the epithelium. We apply the excimer laser. And by the way, the laser works from about the distance about this far away. It doesn't touch the eye.
Oh, okay.
And
Not
you don't-
touching the eye. Yeah, we're
well,
gonna talk
doesn't-
about it.
doesn't touch the eye and you don't feel a
how
thing.
it feels and all that stuff.
Yeah. So it's done from about this far away. And then a contact lens is placed on the eye. It's called the bandage contact lens that stays on for about 2 days, during which time the epithelium grows back. Or it's putting a bandage or a blister on or band-aid on a blister. And that's known, has several names. PRK, not to be confused with the old RK, which used to be done with a knife, a diamond,
Yes.
making cuts in the cornea, not with a laser. So PRK, LASIK, LASEK instead of IK, epi-LASIK, or really the best description is an advanced surface ablation or surface treatment because it's done on the surface. So we correct, again, nearsightedness, farsightedness, and astigmatism either through LASIK, under the flap, or on the surface.
All right. Different procedures, different candidates, different type problem will require different surgical procedure.
Most of these procedures can be done for or any and all of the above. However, some people are better candidates for one or the other,
Right.
both physically and emotionally.
Yes. So yeah, why don't we talk about that? Who would be first of all, who is a candidate for LASIK? Let's use the traditional. I guess we should go with the LASIK, right?
Okay.
And who would be candidates for that? Who wouldn't be?
It's much easier to say who wouldn't be.
Who wouldn't be? Go right ahead.
Those who are sick, or meaning have eye problems, serious eye problems. I'm
Right.
not talking about small eye problems. Those who have meaning conditions of the cornea that makes the cornea not healthy, or they already have advanced cataracts or severe diabetes. That mild diabetes is not a problem. Severe glaucoma, macular degeneration, all these things are not really.
Yeah.
Eyes are not healthy. Certain collagen vascular diseases like rheumatoid arthritis and lupus are questionable whether they should, unless it's extremely mild, they should probably not have it either. And people should not have LASIK if their corneas are too thin. Now, you know, people are short and tall and come in all sizes. Corneas also, most of them are a certain thickness, but some of them are thin from birth, genetically speaking.
Sure.
And if the cornea is too thin and you cut the flap and then you remove whatever you have to remove, you weaken it too much. So those people are only candidates for I call it PRK, or the surface one.
Yes.
People like in law enforcement or people who are involved in extreme physical activities probably should also have the surface one. The only disadvantage to the surface one is that it takes a little bit longer to make that 2-3 days instead of overnight to recover.
I see.
Also, by not having the flap, again, correction officers or people involved in extreme physical activities, there's always that danger that you get hit in the eye just the wrong way, the right way, and could move the flap.
So a sports figure,
sports,
somebody, a professional sports person.
Depends on the sport, you know.
Yes.
Depends on the sport. Football, obviously, it's even though they wear helmets, I don't know how much. But you know, karate, judo, this kind of
Yes,
thing.
close contact.
Yeah, close contact definitely should not be. Hockey, they hit this a lot in
Yeah, sure.
hockey.
Of course. Wow. Yeah.
So, and again, there are patients who want immediate results,
Mm-hmm.
and there are patients who want the absolute safest, and they're both extremely safe.
Yes.
It's like comparing the safety between two cars. One may be a little bit safer than the other, but nobody buys a car based on the fact it's a little more safer than the other. People,
Right.
So the PRK or the surface one, it's a little bit safer because you do not have this flap. But it takes longer to recover. And if you don't want to be incapacitated or rest for a weekend, I had PRK myself 16 years ago.
Okay.
And it's not a fair comparison because at that time LASIK wasn't developed enough for me to go for it.
Yes.
Today I would probably still have PRK. But again, I have lots of lasers and I do lots of LASIK, and everybody's very happy, and
That's great.
We aim to please. I'm sure you have a lot of tricks in your the
For
way
sure.
you adjust people, and
Yes.
ultimately the results are the same. A month later,
Mm-hmm.
they all see the same,
Mm-hmm.
and they're very happy.
I have a question. People who develop problems, neck problems, and whatnot, oftentimes it will affect their vision. Is that correct? Just talk about that a little bit.
I think they make them. It's more a little bit more the other way around. I think their vision causes them to have neck problems.
There you go.
Because by having to move their heads through the progressive lenses, or by not being at the proper distance from the computer monitor, or having bad sitting or posture problems, and then with the computers, the biggest problem is they forget to blink.
Right.
And I know myself sometimes at night, you just try to move the mouse a little bit at the last, and you fall behind. You're supposed to blink every 5 to 6 seconds.
Yes.
You blink a second later, and you blink a second. It adds up, and all of a sudden people have dry eyes. That's a problem.
I see.
So that's
okay. Are there any side effects? Let's go back to the LASIK just a little bit. Are there any side effects to the LASIK procedure? Are there any downsides
other
to
than
that?
financial?
Yes.
Other than financial.
Other than financial. Right. Which
when the laser first came on, first it was embraced, then it was bad-mouthed a lot. There were probably initially some people. There were some of them that shouldn't have been done, and some people must have had the bad results. And much like more people are afraid of flying, even though driving a car it's a lot more dangerous.
Correct.
And when it comes to eyes, psychologically there's a lot of fear, and people still think that Jaguar is unreliable, even though it was unreliable 25 years ago.
Right.
Potentially there could be side effects. In general, they are minimal to, in my opinion, my practice, practically non-existent. I don't want to say they are now not. And essentially, like right after the procedure, especially after PRK, and a little bit more so after, a little bit less so after LASIK, you have some glare at night. But most people have glare to begin with. It's just that they don't notice it.
Right. Okay.
So I try to tell everybody before you have the laser, whichever one is going to be, please pay attention to how you see at night, because I'm willing to bet you never noticed that the BMW's xenon lights have rays coming out of the headlights, or the neon signs, or whatever, and then you have the laser and you never paid attention before, and then you blame the laser for PRK.
Yeah.
Dry eyes, some people develop dry eyes, usually it's temporary, and if it's not, we can treat that, or there are all sorts of things we can do. Usually artificial tears, there are some medications, there are plugs that we can use. Vitamins are very important. Smokers, I always don't like smokers. I tell them, please try to, there are plastic surgeons who don't operate on smokers.
Yeah. If you like, sure.
So dry eyes, we may not hit bullseye. We may be a little bit over this way, a little bit over. That usually that can be corrected. You have to do it again, touch it up.
Sure.
Those are really the major things that I can think of.
Okay.
If everything is done properly and the person, if it's
diagnosed
done
properly,
appropriately and measured properly prior to the procedure.
Always so important, right? In any doctor relationship, to get the diagnosis correct. If we were talking about a too thin cornea, I'm sure all these procedures are looked into before you even attempt to do the surgery.
That's right.
And then so they know they're getting the best result.
Yeah, and I always try to talk with the patient. And also, you asked me once who also is not a good candidate.
Yes.
People with unreasonable expectations.
There you go.
And
Yeah.
that is the one of the almost the worst. Then because if you have an unreasonable expectation, then
Nothing will
I can't make you
satisfy them.
happy. I
No,
can't
no
make you
way.
happy. And
No.
once in a while, somebody slips through that says, "Oh yeah, I'll be fine, I'll be fine," and then
Yeah.
you have to have reasonable expectations. And I go over and I show them and I show them and I show them. I explain, in your 40s or 50s, you're gonna need some reading glasses or some help.
Yes.
This and that. I cannot make you perfect. I cannot make you 25. If they 25 or 30. Um, People who are not candidates also are people whose vision is changing, but it has to change a lot not to be a candidate. 99.9%, 99.9 probably percent of the people, once they reach in the early 20s, the vision is stable.
Yeah.
And women mature or stop changing even earlier than that.
Yeah.
And if the eyes are stable, you can treat somebody as young as 17. As
Right.
long as you have documented 2-3 years of level
Level
no
vision.
change in
Yes.
prescription. And even that you have to be very careful, because if the eyes are not measured properly, and by that I mean with the drops that dilate the pupils and cause you may give everybody at that age a little bit stronger glasses because they can compensate.
Yes.
And so they may appear that they're still changing, but they're really
Right.
not changing.
Great.
So
Well, last question here, Doc, before we wind up here. It goes so fast, doesn't it? Does insurance cover any of these procedures? Or?
some vision plans, and rarely insurance, afford their members a discount if the physician participates with that vision plan. The patients are getting a discount. Insurance companies, unfortunately, do not pay anything for the procedure. But such a plan like Davis or VSP or there are several
vision
other
plans,
ones. Yes,
sure.
Spectera. They do give patients a discount.
Great. Great.
And there are also payment plans.
Okay. So anybody who really wants it, you'll make it
Somebody really
available to
wants it,
them, or we'll make it work.
We'll make it work.
Great. Any last thoughts before we close?
We left out, there are other procedures that are
Yes.
very important for the correction of vision.
Right.
There is a procedure known as CK.
Yes.
It stands for conductive keratoplasty.
Yes.
And that is very good. It's been approved by the FDA for the correction of presbyopia.
Great.
It doesn't correct it completely, but it helps it a lot.
Awesome.
There are also special lenses that you can put inside the eye, even if you don't take out the cataract. It's called ICL, intraocular columnar lens. There is clear lens extraction. I can go on for another 2 hours, but I think we're running out of time.
I know. Maybe we'll come back and do a second show
Okay.
on those procedures. That's terrific.
Sure.
Hey, Doc, I want to thank you for being on the
Sure,
show.
my
This is
pleasure.
Terrific. If you have any questions for Dr. Saimovici, you can certainly email him or look on his website and get any information that you might need. So I want to thank you for being so attentive. Good night. Look forward to the next show.
Schedule your complimentary LASIK consultation with Dr. Saimovici now by calling the location nearest you.